emissions coming from? They're coming from a range of sectors, from the power sector, as the slide summarizes, power, industry, transport, buildings. Some of these, such as transport, are going up very quickly. Tremendous growth in road transport, private vehicles, heavy good vehicles in many parts of the world. But perhaps rather surprisingly, quite a lot also from land use and agriculture, partly due to deforestation, partly due to increases in livestock because of increases demand for animal products. The gases concerned, several gases, most important carbon dioxide, which is a long-lasting gas. Once it gets up in the atmosphere, it'll be up there for more than 100 years. Methane, which is a potent greenhouse gas, but much more short-lived, lasts for a couple of decades. And a number of much shorter-lived greenhouse gases and pollutants, such as ozone, oxides of nitrogen, and also black carbon. Black carbon I'll talk about in just a moment. Black carbon is produced by incomplete combustion, particularly when biomass and sometimes fossil fuels are burnt. So what kind of impacts could all this have on human health? Well, it depends very much on how we adapt, how human society reacts and adapts to climate change, and also modulating influences, by which I mean how rapidly the economy grows, how many poor people we have in decades to come when people start to really feel the full impact of climate change. There are a whole range of indirect mechanisms by which climate change can affect health that are summarized here, and these can lead then to changes in water-related diseases, extreme weather-related health effects, floods, droughts, storms, foodborne diseases, vector-borne diseases, and malnutrition. And I'll say a few words about some of these. Of course, I have to say at the outset, there's obviously a lot of uncertainties. There are limitations of the evidence base on impacts. Many of the countries we're most interested in have the least data. And in order to be sure, to be secure in deciding whether it's due to climate change or not, we need long time series of data, obviously. And many other factors are changing. Drug resistance is changing, for example, insecticide drug resistance, vector control programs for malaria, global trade patterns, migrations of population. And there are all sorts of interaction with other environmental changes, such as deforestation. So there's kind of a compounding of uncertainties. But to add to that, we're not going to stand around and just wait for climate change to have an impact. It would be unethical not to improve adaptation, to try and strengthen the resilience of societies to respond to the challenge of climate change. So there are three overarching research topics: to understand the impacts of climate change on health and the vulnerability of different populations, adaptation to climate change, how effective it might be, both spontaneous and planned adaptation, and finally, and very importantly, the focus of our FENA conference, the health effects of mitigation. By mitigation, I mean strategies to reduce greenhouse gas emissions. And they themselves can have a number of health benefits, some harms, but a number of health benefits as well. Let me then take you into some of the impacts. Well, the first one is this slide taken illustrating the French heat wave, European heat wave of 2003. This was a dramatic event, broke all the temperature records all in many parts of Europe, and it resulted in about 15,000 deaths, probably well over 30,000 in Europe as a whole, about 15,000 in France, and you can see the picture here in one of the emergency departments during that heat wave. And here you can see the death rate, and that line here shows you the temperature. You can see how it went up in August, at the end of July, started to climb up and was maintained at this very, very high level for quite a few days, well over 30 degrees, which is very high for much of France. And you could see that the death rate, these vertical bars here, started to go up and reached a peak of over 300 a day in Paris after about 12 days or so of that heat wave. So that sustained hot period was undoubtedly caused the very large numbers of deaths that we saw, which was much larger than many other heat waves. And you can see the temperature and the numbers of deaths in comparison to previous years, much, much lower. So why did the 2003 heat wave cause so many deaths? One was that the temperature was maintained very high level for a long period. There were high minimum temperatures. The temperature didn't get much cooler at night, so people had no opportunity to cool down. And that particularly affected elderly people, many of them in residential care homes without adequate cooling or air conditioning, some of them trapped in top floor apartments or old buildings without proper ventilation. There was a lack of surveillance, of monitoring, so the French authorities were not aware of the full magnitude of the health impacts until it was too late. Many of the hospital and care home staff were on holiday, they were understaffed, there was a poor meteorological forecast, they weren't expecting such a long heat wave, and there was no public health measures or organised response, and as I say, a lack of air conditioning in many houses. There are a number of intervention measures that can reduce impacts. Short-term strategies such as weather-based warning systems and heat advice to the whole population about keeping well hydrated and cool. Long-term strategies to improve the care of the elderly and improve the environment of care homes. Housing design, more energy-efficient houses that heat up more slowly. And reducing the trapping of heat in urban centres, often called the urban heat island effect. So by planting more trees, having more green spaces, more lakes and ponds, you can reduce that excess temperature of urban centres. And following this heat wave in France, the French did mount a very concerted effort to try and reduce the impact of heat waves in future years. And in fact, the most recent heat wave, which is a much smaller one, but still the evidence that we have from a paper published a couple of years ago suggests that the 2006 heat wave caused only about 2,000 excess deaths compared with over 6,500 that were predicted on the basis of the early experience. So something about those public health measures that they've put in place seems to be having an impact.